Well, an estimated 987,000 New Yorkers have diabetes. About 19% of them don't even know they have it. The numbers are according to the New York City Health Department. But what's even more alarming is how quickly those numbers appear to be climbing around the world. Some experts say the epicenter, though, of the diabetes crisis is right here in New York. Narmeen Chaudhary is here with more on the story for us tonight. Narmeen.
Tamsin, that epicenter is the Bronx, and the numbers there, much like the rest of the country, keeps climbing. Education about the disease is critical. And if this disease is left untreated, you are left susceptible to a heart attack, stroke, blindness, kidney failure, and even amputations.
For me, it's been like riding a wild roller coaster. You know, 1 minute I can control it, the next it's not controlled.
Howard Jones is 72 years old. 8 years ago, he was diagnosed with type 2 diabetes and came here to the Diabetes Center at St. Barnabas in the Bronx for help.
I was gaining a lot of weight, couldn't lose it.
Jones, like so many of the patients here, had no idea why he was feeling sick.
We're really sort of the epicenter of this epidemic. There's been an explosion of diabetes in the Bronx, in New York, in the United States, and across the world.
Harris Leitstein is a nurse practitioner and certified diabetes specialist. He says here in the Bronx, factors like poor access to fresh and high-quality foods is a major culprit into why the numbers of diabetes patients keeps climbing. The disease also happens to hit Latino and African-American New Yorkers even harder. 28% of the patients diagnosed here in New York are Latino, 31% African-American.
Much like with high blood pressure, you can think that you're ignoring it and getting away with it, but it's always going to be there and it's always going to catch up to you.
Here are the symptoms you should be on the lookout for: insatiable thirst, urinating frequently, exhaustion, and blurry vision. Despite so many complications from his own diabetes, Jones says he has made major lifestyle changes to make sure his blood sugar stays under control.
I know one thing, I'm not giving up.
Now, coming up at 10 o'clock tonight, we talk about another very critical chapter in the conversation about diabetes, and that's insulin and why so many people are making life and death decisions because of its increasing costs. I'm Narmeen Chaudhary, PIX 11 News.